Infant circumcision is a practice that often gets questioned by parents. It's a decision that every new parent will make for a baby boy. What are the pros and cons of circumcision? What should you consider when making a decision? I am Dr. Badair, a board-certified urologist and director of San Diego Circumcision Center, and this is Parent Savers, episode 41.
Faster than a speeding toddler.
Sit still for just a minute.
Can soothe boo-boos with a gentle kiss.
Would you get down from there?
Able to clean poopy bottoms in a single swipe.
Oh, what did you eat?
Turning frazzled mommies and daddies into procreators of peace and harmony.
Ah, quit touching me.
It's Parent Savers, empowering new parents everywhere.
Welcome to Parent Savers, broadcasting from the Birth Education Center of San Diego. I am your host, Casey Wilt. Parent Savers is all about helping new parents from the baby years to the toddler years, and we are so lucky to have amazing experts at the show, so shoot us an email, call our hotline, and we'll get your questions answered. We also have a free app, a free newsletter. You can like us on Facebook. I know you're all on Facebook out there. You can send me an email. You can call our hotline. So there's so many ways to be a part of our show. Did you miss an episode that's been archived, or you want to keep talking to the expert once the show stops? We have a Parent Savers Club, and it's where you can download the archived episodes, get exclusive content, and so much more. So I am a new parent. My son Carson just turned 2, and I'm joined by 3 new parents here in the studio.
I'm Scott Killian, certified financial planner, 36 years old. I have one boy, Alex, who is 3.
I am Robin Kaplan. I am an international board-certified lactation consultant, owner of the San Diego Breastfeeding Center, and also the host of our sister show, the Boob Group.
It's fun to have you here.
Thank you for having me. I am 36 years old as well. I have 2 boys, Ben, who is 7, and Ryan, who is 6.
And you don't have little kids, but we're, letting you come on the show because
exactly.
We've all been. You've 2 boys.
Exactly. It's a very interesting conversation. Absolutely. Yeah. Thank you.
And my name's John O'Real, and I actually have 3 boys. I'm 38 years old. My boys are 5, 3, and 1. And they're all circumcised. I don't know if that's relevant to this conversation or not, but I'm sure it'll come up. And
yeah.
I'm excited to hear the conversation.
Before we start today's show, here's blogger Dwayne Richards from Daddy Doing Work.
Hey, Parent Savers. It's Dwayne Richards from the blog Daddy Doing Work coming at you. My blog's all about being a new dad, so I'm adding a dad perspective to things. And today we're talking about some of the worst parenting advice I've ever heard. And believe it or not, all this stuff is real. First off, I'm an African-American guy, and my wife is Japanese. So our daughter, who is 21 months old, one person said, why don't you just hold her nose closed so it doesn't get so wide? That'd be a good idea. I'm sitting here like, oh my gosh. And she was really not kidding. So that was really, really bad and offensive, but I got over it. Another person said, you should always drive because if you need to breastfeed, not me, but if your wife needs to breastfeed your kid, and she can just pull her in the passenger seat and breastfeed. I mean, I'm telling you, even Britney Spears thinks it's a terrible idea. Living in Los Angeles, there's all types of body image issues. So one lady said, put her on a diet. Just put her on a diet so she doesn't get so big, because if she gets big, she's going to get made fun of in school. So it's just terrible. Some of the things I've heard are just amazing, but I just always stick to my gut when it comes to advice, because you know what? Nobody knows your kid better than you do. That's just the bottom line. Thank you so much for listening to this one. And if you have an idea for a parenting topic that you want to talk about, please email me at my blog. Go to daddydoingwork.com, or you can go to my Facebook page, which is Facebook/daddydoingwork. Thank you so much.
Today on Parent Savers, we have Dr. Badair from the San Diego Circumcision Center here with us to talk about circumcision decision that new parents will face for their baby boys. So how does circumcision work?
Well, it's one of the oldest procedures ever done in the world. There's papyrus from ancient Egypt that actually shows the practice.
Really?
Yes, from millennia, and most people don't even realize that. And in at least the modern era, it's done. The vast majority is done soon after birth, within usually the first few days up to the first couple of weeks. And it's done primarily in our country by pediatricians and obstetricians. I'm a urologist. I'm an adult urologist, so I see mostly older men. But when boys have not been circumcised in the first couple of weeks and they need circumcision, usually a urologist would do it.
Dr. Badera, what are the complications or side effects of this procedure? Well,
it's a very, very rare complications, especially if it's done by someone who's qualified to do it. The main complication of any procedure when it involves cutting any cutting is bleeding, and it's extremely rare that you have to actually go to the emergency room after circumcision to address that. But most times, all you need to do is apply pressure on the area that is oozing some blood or bleeding. The other complication, or not complication, the other possible side effect is pain during the procedure, and that definitely needs to be addressed and done. The procedure needs to be done proper to avoid that.
My son was in the NICU for a week, and we had decided to do circumcision. But then once he was in the NICU for the week, we didn't want to poke him and prod him with any more needles. And I was going back and forth with this debate. So what we had decided, yes, we now were questioning, maybe going no, and back and forth. I was a wreck. I was an absolute wreck. And he went with my husband, and I just stayed at home because I didn't want to be a part of it because I still was conflicted. And so, but then after hearing what happened, that they gave him a shot, and they gave him sugar water, and my son literally was sucking the pacifier, going, stopped for a second after when they did it, and then went, and not a peep, not a cry, nothing. So it was more traumatizing for me at home than it was for him. And that, also could be the way that it was done in a hospital with an injection of local anesthesia. How does that work? I know my child was fine, but other children are screaming. Do they hold them down? What does it look like?
Well, first of all, just addressing the pain medication, I think using local anesthesia for it should be done. There's no reason why not to do it. It's like going to the dentist without getting anesthetized. Why? Just having a little injection, it helps a lot. And it's such a small amount of anesthetic that, and it does wonders. In the older days, they didn't do that. So they used to say, well, the baby, it's not mature enough to feel or whatever, and that's not true. The babies will feel it. So I don't really see any reason to do it without local anesthetic. I can't speak for every practitioner, but I've never done it without local anesthesia on children, on neonates, even if they're just born, or obviously on adults. And it's simple enough to do it. So what you do is you have the baby. The babies hate lying on their backs, no question about it. And unfortunately, our tables are not always very soft. So they're okay for a few minutes, but then they get very fidgety. The procedure, usually they're complaining more about their positioning than about any pain.
Okay.
And you start with a very, very tiny needle. Sometimes I put anesthetic cream, before I even put the needle, so they don't feel the needle going in.
That's very nice.
And then I tested, make sure they are not, feeling it, because I can pinch it and see the reaction, and nothing happens. And then there are different techniques to doing it. Most of them involve some kind of a clamp that protects the head of the penis, as the foreskin surrounding the head is incised. And some are actually plastic, and they stay with the baby, and it falls off a few days or later. But usually the way I do it is I use the metal one that the baby, when they leave, there's nothing attached to them. And it's surprising how most of the kids really, either sleep through it, or have a bottle and they suck through it, or they just get uncomfortable lying flat on their back.
Is it a fast procedure?
For babies, it is. It's about 5-10 minutes.
And then when they leave the office, when the Novocaine wears off, is that excruciating pain?
Well, obviously I can't speak for the baby, but I can hear what parents do. They say that they usually are fussy for a little bit. Some parents say nothing happens, but the worst I've heard is they're fussy overnight. But if it depends on the age, and if they need to take any anti-inflammatory, it's extremely rare that you need to give them something afterwards. The other point about doing it that age is you don't need to use any stitches. The reason is the blood pressure of infants is quite low. And after about 8 weeks of age, it starts getting higher. So the risks of bleeding are extremely small. And what that clamp does, it seals the skin edges. And because the blood pressure is low, it heals quite fast. And they heal within a few days. It's amazing.
As in compared to an adult would
Yes.
be a lot longer and a lot more painful, you think, because of it?
It's much more involved. It depends on how old they are, obviously, but most adults get it under local anesthesia as well. They obviously are more anxious because they're.
I think we're all sitting here crossing. They're like, this, at least.
and the same thing. You test them, make sure there's no feeling around it, and that's part of the reason why I felt that if I do the anesthesia properly in a baby, they don't feel it, because I have so much experience in doing it with adults, and I know how they feel or they don't feel, and I translate that to a baby. And I really believe if the anesthetic is done properly in a newborn, they're not going to feel it. The adult you have to use stitches, and the question of the technique, or there are different techniques, but that's.
So would you say then that there's sort of an ideal time period in infancy before that 8 weeks, I think you said, where the blood pressure goes up, that's kind of the ideal time period
Well, and
for
in Jewish
circumcision?
customs, it's how many days?
It's 8 days.
8 days.
Yeah, I think the younger the better
Okay.
in general. I think the easiest time to do it is the first couple of weeks,
Okay.
By far. After the first couple of weeks, even though parents may not know, but a lot of pediatricians and obstetricians will not do it, and they will refer it to a urologist, and it becomes a slightly bigger deal to find somebody who's going to do it, and do it in the office or under anesthesia or general anesthesia or whatever. It becomes a bigger deal. But you can do it at any age. I mean, I've done it from day one all the way to 80s if we need it for that.
So my question for you is, what are the benefits and disadvantages of infant circumcision or circumcision in general?
Well, the benefits, and I kind of, I'm glad you asked that, because the American Academy of Pediatrics just revised their policy statement on circumcision last summer. And basically any big accrediting body or educational body in the United States, when it comes to specialties, they come up with policy statements every so often. And when it comes to circumcision, it's a big group of experts that are pediatricians, urologists, ethicists, obstetricians, and they get together and they look at a particular topic. In this case, circumcision, and their recommendation, the last one, came out extremely strongly for circumcision. It came just short of recommending it for everybody. And you can find it online, and I'm not going to bother reading it, but it's so strong as to say that there are definitely many benefits for it, and the benefits are there's a multitude of them.
What do they
one.
include?
Okay, let me go through them. The first benefit, as a child, I personally think the benefits are when you grow up older, but as a child, you have a lot less infections. The visits to the pediatricians are less.
How is that? Why is that?
Well, the foreskin, no matter how clean you keep it, it's going to always have bacteria and inflammation underneath. And bacteria can go through the tip of the penis, the urethra, into the urinary tract, and it can cause infection. So that is noticeable in the childhood years.
Okay.
And then as we get older, then more of the benefits will show up. Number one, if you're circumcised as a child, you will pretty much never have penile cancer. Penile cancer is almost unheard of in any circumcised person who was circumcised at birth. When you're circumcised later in years, it can happen, but to a lesser degree. So there is a benefit to getting rid of chronic inflammation under the foreskin that's over years and years, and then that can turn into cancer in the future, because chronic inflammation can become cancerous. So it is a reportable thing to have a case of penile cancer in someone who's circumcised at birth. And the cancer is not in the foreskin, because some people say, well, of course, you're going to remove the foreskin, you're not going to have cancer in the foreskin. No, the cancer is actually the most common penile cancer is on the head of the penis and the area underneath it. So that's a protective mechanism, and I look at it like you're vaccinating the child against one form of cancer, and to me that says something. Then as children go through teenage years and become exposed to other children through sports or showering or whatever, socially, the uncircumcised children, studies have shown that they feel different in our society, and there is trauma, emotional trauma associated with that. When it comes to dating years, that also gets compounded.
But if you're in a culture where it's a common thing to be uncircumcised, is it then reverse?
Correct. Correct. I'm talking specifically in our culture,
in American
culture, but absolutely, yeah. I mean, that particular aspect of it is not going to happen then.
Mm-hmm.
Then, as you get older and become sexually active, then to me, some of the more important benefits show up. All sexually transmitted diseases that are virally transmitted are 50 to 60% less common if you're circumcised. And HIV/AIDS is 60% less common if you're circumcised. There are 3 major studies in Africa that looked specifically at that topic that proved beyond doubt that that is the case. And it was such a strong belief that the American Urology Society has created a task force for adult circumcision to Africa, to go to areas that are highly has AIDS, prevalent AIDS, and low risk or low rates of circumcision to do that on volunteer basis, obviously. So that's a very strong point. Not only is it protective for the male, the transmission rates between females and males also vary depending on whether you're circumcised or not. So in Europe, if you have sex with a female and you're not circumcised, and that's where the studies came from, you are at about 10 times higher risk of getting HIV than if you're circumcised. So that's pretty strong evidence. The other benefit to females is cervical cancer in female partners of circumcised men is much less than in uncircumcised men. And again, I think it goes back to the point is no matter how clean you try to keep it, because people say, well, we'll just clean it. The skin underneath, the inner part of the foreskin is very flimsy, and it doesn't have a strong barrier for viruses and bacteria to basically go through. And there's always degree of inflammation no matter how clean you keep it. And I think that makes the portal, the entryway, much easier for these viruses to go in.
Does the diet of the individual have anything to do with the bacteria that could be present?
Not really. I've never read anything to do with this. I know that for uncircumcised guys who are diabetic, it's more likely source to have infections. But that's not specific. I mean, it's because diabetics are more, so there is, I guess, sugary, if you're not metabolizing right. But I don't think diet affects that.
And you're saying that there's no way to keep it clean?
No, you can keep it clean. But the question is, it's like, how can you get rid of bacteria in your mouth? You can brush, you can do that, but there's still going to be bacteria in your mouth. The area under the foreskin doesn't get exposed to air long enough to make the skin a little thicker. We call it keratinized, so that the skin layer is more protective. The skin is a very, very protective mechanism for our body to prevent a lot of infections. And unfortunately, with the foreskin, in that area, it becomes it's very thin, and there's always going to be inflammation.
Is there any genetic predisposition to somebody having having it more prevalent that there's going to be more infection? Or is it strictly just...
Well, obviously, if you are not cleaning it at all, yes, it's going to be much worse than if you're cleaning it. But you have to go out of your way. I mean, the care of an uncircumcised penis, most circumcised men take it for granted. They don't even think about it. But an uncircumcised penis needs care. And, it actually surprises me in my practice when I see older men who actually haven't retracted their foreskin for years or decades. And I'm not going to get into what I see on the
I know. It's like taking out the couch cushions.
I
know. So, we talked about some advantages. Are there any disadvantages of having a circumcised penis?
Right. Well, just a couple of quick also advantages is the skin can get tighter especially in people, or not especially, but in some people as they get older.
Okay.
So you can't retract it, and that can become a medical condition.
Okay.
And so that becomes an issue as well.
So if you're
So
going to do
phimosis.
circumcision,
Yes.
it actually does benefit to have it during infancy.
I think it's easier, and it has the most benefits when you have it during infancy, but it doesn't mean you cannot have it at any other age.
Yeah.
Some of the disadvantages, or we say the other side of the equation, other than the immediate local problems with bleeding or pain, some people say that the sensitivity changes sexually. And they say if you're circumcised, you're losing that ability to be stimulated sexually. And that is a very difficult point to prove in general, but I can tell you because most of the guys that I circumcised are adults.
You see them adults, yeah.
And I am very sensitive to that point, and I ask them almost universally, before and after, how are you sexually before and after? And of the I must say thousands of guys that I circumcised, I think only one said that it was less sensitive, and a huge number said it's actually more pleasurable. For whatever reason, the foreskin was restricting in their particular situation, and it was much more pleasurable afterwards. So I don't buy into the sensitivity argument, and I know that's a very strong argument that you may read on the internet for people who are strongly against the practice.
Well, we'll talk
sure.
about that in a minute. We'll talk about the controversies surrounding circumcision and whether or not it can be banned in some cities, I'm hearing. So we'll be right back. On Parent Savers today, we have Dr. Bader from San Diego Circumcision Center, and he's here with us talking about the circumcision decision that every new parent will face if they've got a baby boy.
Yeah, and so we talked a little earlier about, getting it during infancy. And I know for us, our pediatrician did the first couple, and one of them was in the hospital, and we never even thought about paying for it. It was just part of regular visits. But I imagine after you go see a urologist, or if you're going into other factors or waiting, or maybe even other people have different experiences, is it something that insurance will cover and they cover across the board, or have you run into any experiences with insurance not? Or
the vast majority of insurance covers it at infancy, when you're young. Some cover it a little older than that, but most adult circumcision is not covered.
Okay.
Unfortunately, Medi-Cal, which is a strong part of coverage for obstetricians, newly born kids in our state, does not cover it. And
I'm hearing it's being called a cosmetic surgery.
Correct. And I'm hoping that will change with the American Academy of Pediatrics statement. They strongly said that all third parties, meaning insurers, should offer that and should cover it. So I'm hoping that will be an option for everybody, if they decide to do it. And maybe there's talk about the new healthcare system that being introduced as part of, if you want it while you're on your Medicaid or Medi-Cal, then you can still have it.
Well, if insurance didn't cover it, how much would it cost?
It depends also how old you are.
For an infant, say.
In an infant, I'd say the average, and I'm just throwing it in my office, I can tell you it's about $450, $400 or $450. I think that's how it is.
Well, I think it's one of those things that sometimes you hear if insurance doesn't cover something, you think it's a roadblock. But then really it's maybe
you just pay out of pocket.
Yeah, and $400 is a lot of money. I'm not saying that it's not, but it's also not $4,000.
Absolutely.
So. Well, Robin,
I was going to say, so
you.
So we're Jewish, and so we had a bris when my boys were 8 days old, and insurance did not cover it. Because it was not done in an office, in a physician's office. So the man who is, they're called moils, and they're the ones that perform the circumcision ceremony, what have you. And he is a pediatrician. But because it was outside of his practice, we had to fork over about $450 per kid. And that
can you do it in the office and then come out and pretend, or no. that's so against
well, so it's funny that you asked that, because I actually, although I'm more happy with our decision now that I've heard all of these benefits, but I had a really challenging time coming to grips with doing this. One, because I had to be there during the process holding, and my sons were both anesthetized prior, about 30 minutes prior.
Do they do that for everyone?
Not
in the
all.
Jewish custom?
No, but the pediatrician / moil that we were working with does use anesthetics. So we did that, and then, but it's it's a ceremony. So it's done in front of 70 of your closest friends. And that whole part really bothered me because to me, you're celebrating your son being, I guess, taken into the Jewish religion. But for me, I mean, my sons, they screamed. And I had to sit there with a little bit of wine on a gauze, having them suck on it. And so I know that they're past it, but it was extremely traumatic for me. And so the second time around, I was like, I don't want to do this. But it was very important to my father, who really doesn't ever ask for anything. And he paid for it, and he paid for the party. But the first time around, we actually, I took my son and we went into the other room, and we didn't come out for about an hour and a half. I was really upset by the whole process. And I think for me, especially now knowing as my son has flourished into this 7-year-old, he's very, very sensitive and a very low tolerance for pain. And so I agree with what you said, that, it depends on how the anesthetics are used, because I'm pretty sure that he felt it. And I know that he cried when we laid him in the little container kind of that he was in, and I wholeheartedly agree with you, because I see babies have frenotomies all the time, and I know laying on their back and being held in kind of a swaddle position is very uncomfortable for them. So I agree with you on that. But he definitely, his shrieks went higher when he was being cut. And so it was just, for me, it was very traumatic. And we did it because of religious purposes, but it was very conflicting for me to make that decision, because I don't know if I would have done it otherwise. And again, the benefits make me feel better now, but it's still it obviously, you had me on the show 6-7 years, and I don't have a 2 or 3 year old. That it definitely stuck with me.
Well, and do you think that a situation like that it wasn't, the anesthesia wasn't used properly?
It's possible that the injection wasn't enough, or it wore off by the time the ceremony.
Yeah, because 30 minutes.
The ceremony can take a while as well. So there are many reasons. Or obviously your sense that you knew that he felt it, and there are some people who require more anesthesia. There's no question about it, and I know that in adults.
Absolutely.
And so you kind of, as a physician, you make your best estimate what's safe to give and the volume, and you give it. And I totally appreciate how traumatic that is to the mother. I totally appreciate it. And
especially with those postpartum hormones, man. It's not pretty.
And I can tell you that when we do it in the office, it's rare that a mother is present. And I usually recommend that the mother goes for a walk, because it's something, it's your new baby. What are they doing, But it's the same. I look at it as, if you are going to vaccinate the baby, he's not going to like that either. There are things we sometimes do because we think it's the better thing to do, and yes, we should make it as comfortable as possible. I'm not debating that at all. But I don't like to go to the dentist, and I still do it.
So why is there a controversy? I wanted to share. I was up in the Bay Area, and I actually was with a friend. And I was at a baby fair, and I thought, this is great. This is where I would be with a booth on Parent Savers. And I cloth diaper. I say my child's grass fed, because we're all organic family and blah blah blah. So I fit right in. It's a total greenie thing. And then a man from a circumcision booth wanted to hand me something, and my child's already circumcised, wanted to hand me something. So I said, no, thank you. And I just walked by, and he said something that was so angry towards me. Like, he wasn't causing anger towards me, but like, did you know blah, 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 or said something like that. And he really offended me. I questioned circumcision. So I'm not a person who went in and said, sure, I'm going to do what my doctor says. I don't do that for anything. And so I went online and I looked for the pros and I looked for the cons. And like I said earlier, my son was in the NICU for a week. So after that, I was like, no more needles, no more IVs, nothing. I don't want him on anything. And so it's something I definitely wrestled with. So having someone question my decision from the outside, even though I already questioned myself, I'm already doing it myself. And so I was surprised that there was a controversy. I was surprised that I know some women do breast milk over formula, and there's controversy there. And there's some people that do cloth and disposable, and the controversy there. And sometimes I look at it and say, why? Why is there controversy? And for this circumstance, stance of circumcision. Why is there controversy? Why isn't it just this part family chose circumcision and this one didn't, and we all live in harmony? What is this? What is the controversy about?
I think there are two main factors that some people feel very emotional against it. Number one is you're making a decision for the baby instead of letting them make it for themselves. And the other one is some people truly believe that it affects them sexually, even though I don't agree with it, but who am I to say? And they believe that you're taking away an important part of sexual pleasure. And again, I don't believe that. So they get a little militant sometimes, and what I could find online when there's a lot of people who really have very strong feelings, and it's emotionally based more than anything. So I want to address that because I think it's important. I think it's very, I don't want to use the word naive, but it's not a well thought of process to think that you're only making that one decision for your child for the rest of their life. You are deciding on so many things for your children when they're born, including what religion to raise them, what schools to go to, what language they speak, how their manners is, if they, and so to think if they're going to get vaccinated or not. I mean, so to think that you're not allowed as a parent to make an important decision like this, I think is not proper. I think as a parent, you should be allowed to make a decision like this. And the thing that compounds that to me more is that a major benefit is the cancer prevention happens when you are circumcised at birth, much more so than when you're circumcised later. So and I mean, I don't remember when I was circumcised. I mean, it's more traumatic for the mother than it is for the baby, and so I mean, I think you as a parent have every right, if you believe it's the right thing to do.
That's true, because that's a thought that I was reading it for preparation of this article, was talking about letting them make the choice. They're a baby. They don't know the choice. Let them choose when they're older. And I felt guilty too. I was like, oh yeah, I should have let him make a choice. But it's interesting that you say, we speak English in our house. And
yeah, exactly. Well, the other thing is, I mean, think of our human body. We require a tremendous amount of maintenance. And our maintenance changes also, as evolution changes. I mean, I shave every morning. I shower. I think most of us shower. We brush our teeth. We cut our nails. So to think that we're born the way we are and we're not supposed to do anything to our body, I think is a little naive. And to me, this is a little extension. I mean, some people think it's going overboard, but I don't look at it that way when I take into account all the other benefits that I mentioned in sum total, not just any one of them.
Dr. Bader, why is it being called genital mutilation?
I think the only people that I've heard calling it that happen to fall into the camp of the extreme emotional group that is so anti-circumcision. I looked up what mutilation is in the dictionary.
Okay.
And it doesn't fit that. In my opinion, mutilation, the way I looked it up, and you can look at it at dictionary.com, it's to injure, disfigure, make imperfect by removing or irreparably damaging parts, or to deprive of a limb or other essential part. I guess you can think of it as you are injuring and disfiguring. I personally don't believe that. I think mutilation is if I'm going to cut my arm. I mean, if I'm going to cut my arm for no reason other than cut my arm, I could see that. But when I look at it for the reasons we had discussed before, I mean, I think it's not, to me, it's not any more than when I got the smallpox vaccine as a child and there's a scar on me.
Dr. Bader, many cities and countries have started to try to ban circumcisions. And is this possible? Do you think we'll be seeing this more in the future?
The short answer is I think it's going to be very hard to do because of the religious freedom question. I think it's going to be extremely hard to do. But when it comes to California, there was a ballot in San Francisco that came up.
Which is where I was.
That's where you were when they were trying to get the signatures. And they got enough signatures to get it on the ballot. And also Santa Monica, the same group was about to start the ballot and they backed out. But the California legislature preempted that. And they came up with regulations to say that is not open for a locality decision. It's a medical decision to be controlled by the medical board of California. Personally, I think it's a very difficult thing to ban because it's so entrenched in the religious practice for Jews and Muslims. and culturally for many other subcultures, that it'll be hard.
Well, and it's just one of those things that I feel like, as we were talking, I mentioned earlier, with all the things about that parenting have, it really is up to the mom and the dad. You know, you look at the facts, you look at your decision for your child, and you make what is best that you think for your child.
Absolutely. I mean, I respect people's decision who make the decision either to or not to do based on knowledge, and not based on emotions and anger and the lack of facts. And absolutely, if you've read or were told about the pros and cons, by all means make the decision, and I respect that. And I find that maybe, unfortunately, a lot of people don't have all the facts sometimes when they strongly decide one way or the other.
Thank you so much, Dr. Bader, for helping us learn about circumcision. If you want more information, go to today's show on our episodes page on our website, parentsavers.com. Our conversation will continue with Dr. Bader. I have a couple more questions I want to ask you after the show for our Parents Savers Club members. We'll be asking about male sensitivity as well as reversing a circumcision, so see our website to sign up. We have a question from Amy from our Facebook page, and she wants to know about brands about cloth diapers. She wants to know which one is best. Which one should she invest her money in?
Hi, Amy. This is Heather McNamara from the Real Diaper Association, and you ask a good question. Everyone wants to know what's the best brand for them, but the fact of the matter is there is no one best brand for everybody. It just depends on the size of your baby, the shape, and your lifestyle. So what style of diapers are going to work best in your family? So what I usually recommend is that you try a bunch out and find out which ones you prefer, and then buy more of those. And you don't have to worry about having invested in diapers that you're not going to end up using, because there's a really good resale market for cloth diapers, and they retain their value beautifully. So you can always sell the ones that you don't like and invest that money into more of the ones that you do.
That wraps up today's episode. We'd love to hear from you. If you have a question for our expert about today's show or the topics we discussed, call our Parent Savers hotline at 619-866-4775 or send us an email through our website, parentsavers.com, or Facebook page, and we'll answer your question in an upcoming episode. Don't forget to tune in to Behind the Scenes Parent Savers Club to keep listening. Thanks for listening to Parent Savers, empowering new parents.
This has been a New Mommy Media production. The information and material contained in this episode are presented for educational purposes only. Statements and opinions expressed in this episode are not necessarily those of New Mommy Media and should not be considered facts. While such information and materials are believed to be accurate, it is not intended to replace or substitute for professional medical advice or care, and should not be used for diagnosing or treating healthcare problem or disease or prescribing any medication. If you have questions or concerns regarding your physical or mental health or the health of your baby, please seek assistance from a qualified healthcare provider.